is. So be sure to call now to book a consultation. Hi, Dr. Tom.
Hi, Michelle. How are you doing?
I am good. Coming down off of a cold, but I'm feeling better.
I see that. For those who don't know, Michelle Marquez is a trooper. She's here with a mask on, running the board, making sure that Karina and I are doing it right, keeping an eye on us. So thank you for being here with us today.
Absolutely.
Thank you. And thank you for talking about the staff, because they're what helps to make us who we are.
Yeah.
Okay. And we have Karina. I think people are kind of getting used to the Karina and Dr. Tom show. Right, Karina?
I guess so. I hope so.
You hope so. That's right. And so just to reintroduce Karina, Karina has been our medical assistant now into our 4th year. A very intelligent young lady who helps me treating patients, both in surgery, she's a scrub tech, as well as helping me with medical treatments, Michelle. And so it's great to have you. Thank you.
Thank you. Thank you for having me back. Yeah.
And so we always try to chat, what should we talk about today? And we kind of have that discussion. And it's always funny that when we pick a topic, that particular patient just walks into the office, right? And I have actually 3 in my brain, and I know we kind of chatted about that when we were driving over here to KSRO from our office on Stony Point, Santa Rosa. And I think the way that we want to look at this today, Michelle, is sort of really the question of, when do I start, or what do I do? Okay,
exactly,
when it comes to cosmetic treatments. And so, when you're an aging baby boomer like me, you've already had probably Botox, a little filler, a little Sculptra, whatever it is that they may need, and what I offer for our patients. But we're kind of looking at that combination of older millennial and younger Gen X. Can't believe that. My son is 40, my daughter's 39, so it's amazing to me. But when should we start to consider doing something? Karina, have you noticed a trend at all in the last year or so?
Yes, I have. I have with the, younger, maybe 30, 40-year-olds around that age that are coming in and starting to say, I want to do something.
Right.
Yeah.
And so that may sound, especially to older individuals like me, so I'm talking about me being a baby boomer, an aging baby boomer, but we may say, oh, why would they want to do that so young? Because we look at ourselves and we're in our late 50s and 60s and 70s, and we're looking at these people who are 35, 45, 46, 47, why are they doing anything? So I think, Karina, it comes down to the way that the world is. Okay, and let me try to explain it by what do I mean by the way that the world is. Okay, so Karina, you have 2 kids, right? Right. And you have boys or girls? What do you have?
2 girls.
2 girls.
Yeah.
And what are their ages?
7 and 8.
7 and 8. One's gonna have a birthday soon.
Yeah, she'll be 9.
She'll be 9.
One-digit birthday.
Okay, so you can see that Karina was about 8 years old when she had her kids. Okay, and so she has soon to be a 9-year-old. Okay, so when you raise your children, do you teach them to judge people by how they look?
No, absolutely not.
Absolutely not, right? And that's why we love you, and that's kind of people that we have working on our team, right? So we certainly need to fight that kind of general human tendency, is that we tend to judge people by how they look in the world of politics, in the world of work, in the world of even friendships and just being out in public. Okay, so I would agree with you 100%, Karina. That's how I have raised my 40-year-old and along with my wife, our 40-year-old and 39-year-old daughter, and in terms of trying to teach them to really get to know a person and not judge them, right?
Right.
Okay, but I've always maintained that if we tell them that it doesn't matter how you look, that we're doing them a disservice, because as much as you may be idealistic and I might be idealistic, people do judge us by how we look.
Right.
Okay, I know that if I'm running around in, old jeans and flip-flops and walking in somewhere, I get treated very differently than if I walk in looking like a doctor.
Right.
That's just the natural way that human beings are. So it is important for us to present ourselves the best we can. And the 3 patients that we were talking about, Karina, were all in their 40s. One is early 40s. I think she's 42, 43 in Napa. And then 2 of our Santa Rosa patients, one who's 47 and another one who's around the same age, okay?
Right.
And we started doing things for them. But if you were to look at them just as individuals, these are strong women, okay? Actually, 2 of them are single moms, and they're caring for their family, and they're working full-time, and they're providing for their children. And the other one also is a very hard-driving young lady in the business world. So these are strong women, and they know that although it shouldn't matter, you know, it should just really matter at their brain power, how they perform their job and all. They know that if we look professional, if we look healthy, and I think that's the key, if we look healthy, people are more open to talking to us and to following what we do.
Right.
Okay, so having said that, and I don't know if the listeners agree with that or not, but I find that in real life that that's indeed the case. Karina, what are the concerns that these older millennials, younger Gen Xers are thinking about when they come in? What do you talk to them all the time?
Yeah, you know, a lot of, if they've never done anything, they're just wanting to get started on something. If they're people who have been doing a little bit of Botox here, you know, some facials, they're really just looking to look good, to look awake, to feel awake, to they just want to maintain their youthfulness. Really, they want to continue to look good, right? They don't look horrible.
Right. Okay. Right. Okay. So you know they want to they want to maintain their youthfulness, as you had mentioned. They want to feel good about themselves. I think that's really important when people come and talk to us for the first time. Sometimes I put these words in their mouth. I kind of like implant this into their brain a little bit when we're doing our consult. And I know you're kind of rolling your eyes, going, "Oh, I know where he's going with this, Karina." But I talk to them about looking healthy.
Right.
Okay. And that if we do things that make you look healthy, okay, even at that young age, okay, mid-30s to late 40s, okay, even early 50s, if we make you look healthy, you will look younger, you will look more attractive, you will look healthier, okay, and in terms of, and energetic. And so for me as an aging baby boomer and as a cosmetic surgeon, and I'll share this with our audience, and thank you, by the way, everyone who listens to us on KSRO every Thursday at 12:30, that my biggest concern, and I think this is probably true for a lot of aging baby boomers, is that we want to remain relevant. Okay, we don't want to become irrelevant. That's what, unless we're Brock Purdy, you know, or the 49ers, he was Mr. Irrelevant, took us to the Super Bowl, right? But we want to remain relevant. So part of that is having energy, taking good care of ourselves, living a healthy lifestyle. Part of that is, a lot of it is attitude, having energy to be able to live in the world and interact in the world. And part of it is how we present ourselves. Okay, so of these patients who come in, Karina, what are kind of some of the first things that we talk to them about and offer them in terms of trying to help them to maintain or even reclaim more of their youthfulness?
Usually it's always skincare. Let's protect your skin. Let's get that, you know, taken care of. And if they're open to it, Botox or Dysport around the eyes to help open the eyes.
So open up your eyes. Okay.
Not so much to get rid of wrinkles or just, that helps, but just to open those eyes for them.
I would agree. So you mentioned the skin, and a great example of that, I mean, you're in your 20s and you look great.
Thank you.
But if we were to take our medical assistant, Bridie, who is she's an aging Gen Xer, okay?
Right.
And people think she's 10 years younger, and Bridie does very little aesthetic kind of procedures, a little bit, but really it's because she took the care, and she is Irish, okay, so she burns with the sun.
Right.
But she really did, you know, even though she's active, she's outside and doing things, she really takes extra care to kind of avoid a lot of sun exposure to her skin, uses Retin-A, okay? And so you're absolutely right. People are always coming up and they can't believe that she's an aging Gen Xer. They think that she's a millennial, right? She looks great. And so you're absolutely right. And for our listeners, that can be some of the least expensive things that we do. So I'm going to kind of list those because I want to get on to the next treatment here. But what I would say, first of all, is sunblock. Okay, that's going to be really important. And you apply that multiple times during the day, not just once in the morning. So you want to apply that multiple times during the day. And then chemical peels, okay, our skin, which turns over about every 21 to 28 days, begins to slow that process down. And I'm sorry, Karina, but when we talk to people about when do we noticeably notice aging, it's about 27 years old.
I in my mind, I started aging at 18, so there you go. I have kids, so that makes me at least 10 years older.
So exactly, you have kids, that's true. I hope my daughter and my son are listening to this show. Okay, so yeah, they definitely age you. So, skin care is really important. Hydrafacials to help to clean up the skin, exfoliate it, good skincare products. If you have questions about that, please come in, talk with Karina. She's an expert on this. She's more than happy to go over that with you. So we talk about skin. And once again, that's kind of the least expensive thing to do, and that's where I would start. Then you talk about Botox or Dysport, which is the other Botox, and that relaxes muscles, and we usually inject it in the frown area and the crow's feet area, and one of the reasons we do that is how it opens up the eyes, okay, and we all want to feel wide-eyed, okay, and I know that I've been so busy, I've been traveling, my energy level was a little low today, and I didn't like it, I don't like it, I just know that I don't have my usual Tigger energy, okay, and part of that is having your eyes be wide open, and people will say, you know, people ask me if I'm tired, and I'm not, I had a good night's sleep, and they really hate that, right? Okay, so we do that. So now we're going to kind of get into more full facial evaluation. What are patients complaining about at that stage?
Oh, well, they're saying, you know, I look tired. You know, it's always, I'm starting to see things a little bit droopy. My skin doesn't look as good.
Right.
Yeah, I would say that's
okay. So what happens as we age is that we begin to lose volume in our face. It's not fair. We begin to gain volume in other parts of our body, and we lose volume in our face. And even if you're a full round, you know, faced Asian man, like I'm 3/4 Chinese and 1/4 Greek, but even with my round face, absolutely, you begin to see some areas of volume deflation. You begin to see hollowing under the eyes, begin to see some jowls, the lack of definition of our jawline, hooding of our brows, which makes us look tired and basically not as healthy, okay? So one of the treatments that I like, Karina, is Sculptra, okay? And so happens to be that these 3 patients that we were talking about, I told you they're in their 40s, a couple of single moms, and a mother who's a really strong businesswoman, working full time, that they want to look their best. They want to present themselves, and they don't want to look done. Okay, so this particular group is the type that doesn't want to look done. They want to look as natural as possible. So one of the very first treatments that I love for young people is Sculptra. Okay, and so Sculptra, Karina, is a powder, which is the same as absorbable sutures that I use when I do surgery. What happens, the body begins to break it down and lays down collagen, okay, and it actually stimulates the cells in our skin to have healthier skin, okay? And so we do Sculptra injections. In fact, it was originally released, for the HIV poor patients some 30 plus years ago who were looking very emaciated and looked like pariahs of society. And by injecting Sculptra in their faces, that then began to build collagen and volume in their face. They looked healthier, okay, and people were less afraid of them, all right, and so that's pretty important. You can imagine that. I mean, that's horrible, right? So we started using Sculptra in the cosmetic world. In fact, I have it in my face, okay, even in my big fat Asian faces, I always say, but I have it because I began to see volume depletion, and I had Mary, who is our lead injecting nurse, inject me with Sculptra as well. So can you tell us a little bit about the process of when we do Sculptra? Because somebody may call and say, hey, I heard Dr. Tom said that there's this great thing called Sculptra, and I'm interested in it. How would you explain the procedure to the patients when they call?
So I would let the patient know that, you know, there isn't much downtime with Sculptra. It's a procedure you walk in and you walk out. There's always a risk of bruising, but that's with any procedure that we do, and that we do use some numbing, so you do use the local for the areas at the injection point for the patient, and then it's a liquid, so we get about 3 mLs per vial, so 3 syringes of just liquid that you are injecting into either the temples or usually the area, you know, really.
the buckle
the
area.
buckle area.
I call it the straw sucking
Yes.
area. So, you know, we know about our cheeks, and we certainly can put Sculptra in our cheeks to lift up the cheeks and plump them up a little bit. And it's the beauty of Sculptra. It's so natural. Guys, Sculptra is perfect for you, okay?
Right.
It is perfect for you because all too often we see men going in for cosmetic procedures, med spa, wherever they might go, and they come out looking feminine, okay? Unless they want to look that way, all right? But most guys don't want that. They want to kind of keep their masculinity of their face, and Sculptra keeps everything the same. It just gives you this ubiquitous, overall kind of nice plumping up of the face in all the areas that we inject, and we inject in almost all the areas on the face.
Yes.
Okay, so they have that, Karina, and of course initially they're a little plumped up, and if they're really deflated and we inject the Sculptra, they may actually think that, hey, this looks great, and we have to tell it, we have to warn them, right? Because how long does that last?
About a day or two.
About a
and
day
then
or
it
two.
reabsorbs.
Exactly. So the water reabsorbs, okay, but we had that slurry of the Sculptra underneath your skin, and then over the next 2 to 3 months, your body starts to build collagen and volume. Your skin starts to look better, okay? And what's the beauty of Sculptra, in my opinion, is I feel that the effects last beyond 2 years.
Right.
Okay, so I think that's great, but it's just not one treatment, so I want everyone to know that, okay? And we're not just gonna inject as much Sculptra in your face as we can. We wanna do it incrementally so that you look natural and you look good, and see how you respond. Most people respond very nicely to Sculptra, so as we mentioned, you may have it, and if you were really deflated and you got it, you go, wow, this looks great. If you were just seeing the early signs of aging, Karina, you may think, oh, it's a little bit too swollen. Okay, oh God, you know, geez, Dr. Tom, I get a text message or a call, you know, it looks a little too swollen. I always have to reassure them, I tell them, it's gonna go down. I've never ever seen anybody look overfilled with Sculptra after the fluid resorbs, okay? So you just have to reassure them and let them know that in about 3 months, and everybody has their own protocol, but in about 2 to 3 months, I'd like to do another session with them. We used to talk about Sculptra being a vial per decade, okay? So you're in your late 20s, so if you thought, hey, you know, I'm beginning to see some aging here and I want to do that, I actually might go very conservatively with you, Karina, and I might say 1 vial, let's see how you respond, but with the thought that you might end up having 3 vials approximately, you know, over a year's time. And you just take your time, do that, assess, make sure that what we're doing for you is keeping with what you want, okay? How many times do you think patients come on back usually for a Sculptra treatment?
I'd say it's definitely a treatment that people come back for, especially if they're only doing 1 vial per treatment and we're slowly increasing, you know, their filling them up.
Their tolerance.
And their tolerance to Sculptra
understanding
and the way, you know, because they're
Mm-hmm.
nervous and they don't want to jump right into it. So I'd say about every 3 to 5 months. If you're like, yeah, let's just put the 2 in my face, let's get it done, then maybe they're coming in twice a year, 3 times a year. It varies by patient.
It does vary by patient, and so just because I said 1 vial, and I'm kind of reserving that, I'm going to say for the early agers, so kind of the people in their 30s and maybe early 40s, you might start off with 1 vial, and then you kind of increase it. The next time you may do 2 vials. By the time you're kind of in your 50s and 60s and 70s or older, you need definitely 2 vials when we first start. So I just want to make sure everyone understands that. So Sculptra is a great way of beginning to revolumize your face, and the great thing about it is how natural it looks. Okay. So then, still, as we inject the Sculptra, we may inject in the cheeks, in the what I call the straw sucking area. If you look in the mirror and you suck on a straw, that part that kind of sucks in around the jowls to help to soften the jowls as well, and even in the temple area, people will still complain of kind of the hollowing under their eyes, and that makes them look tired. What treatment do you like for our patients, that particular area?
Most recent treatment that we have is Easy Gel, Easy Gel PRF. That's always a great, because it's your own body product, your own blood that we spin down and we, you know, curate for you, and you know, less more people are happier. They're not coming back saying, "Oh, this is lumpy," or any of that, because it's your own body.
Right. So if we go back in history, and I've been injecting fillers and Botox and Dysport for over 20 years now, we run into the same thing that just natural human behavior is. A little bit, we put a little bit of filler under the eyes. Hey, it looks pretty good. Then we start putting in too much, and then we start running into problems with lumpiness, discoloration, and so forth, and we end up dissolving it. And to kind of let our audience know kind of how I've evolved, I actually prefer not to inject filler under the eye. I think that it's not a very natural look. So what we do is now offer like elephant zebra, easy PRF gel. And what that is where, and everybody, this is where I need Karina. Okay, Karina is the mad scientist. So Karina is going to draw your blood, 2 tubes, and she's going to spin it down. And when she spins one down, which color tube is it for the PRF?
Well, there's 2, blue and red.
Blue and red, okay. So we're going to spin it down, and one of them she's going to cool so that it doesn't, the PRP, or platelet-rich plasma, which causes healing and so forth, improves the quality of the skin. What that will do is it keeps it from being activated. So you put it in a cooler, correct?
Right.
Okay. And so with that second vial of blood that we draw off, or you draw off, okay, what do you do with that, Karina?
We're heating it. We're putting it in our little incubator for, what is that you always like to say about?
yeah. Well, because when it heats it up, it sort of cooks it, right, and makes it more firm, kind of like the protein in an egg, like the egg white.
Exactly. Hey, Karina, if it's going to be the Karina and Dr. Tom show, you need to answer the question. Don't be asking Michelle to answer the question. All right, so here we are. Michelle's not feeling well, and you're bringing her into the conversation. All right. So basically, what we're doing is we're trying to pull the protein out of that second test tube. So we're heating it up, okay? And that protein is called
albumin.
All right. So see, I am making Michelle work for her money today. So Michelle has said that it's albumin, which is a natural protein. So this is all you, and we're taking that protein and we're mixing it up with the PRP, which is activated. So it's called platelet-rich fibrin. And I have found that injecting it under the eye, that we get very nice results. The skin improvement under the eye is fairly significant.
Right.
In terms of adding volume, I will say that if you're really hollowed out, initially you're going to be a little disappointed because you're going to need multiple treatments with that. You're going to probably need the next thing that we're going to talk about called Renuva to help to support that area under the eye. But Easy PRF Gel, I really like it under the eye because it's just us. You're not going to get the problems with discoloration. We're not going to get the problems with lumpiness, okay, because it is our own body. So we inject that under the eye, and it makes the patients look more wide awake, makes them look healthier, makes them look more energetic, okay? It brings back the Tigger in them. And so I have not had this treatment yet, and I'm waiting for us to be a little less busy because I am going to have it, and I'm going to ask Mary to do that and for you to draw my blood. Just don't hurt me, okay?
All right. It will hurt.
That's what she says. Okay.
For you, just a little bit. For the patients, no pain.
No pain. Okay. Very good. So we're taking Easy PRF Gel and we're putting that under the eyes. Okay. But that under eye area, and those who've listened to us on KSRO, I think, we talk about the eyes and the eyes being the windows to the soul. That under eye area is like the windowsill, okay? But if the wall holding up the windowsill is breaking down, okay, doesn't matter what you do to that windowsill, it's going to continue to break down. So we need to add a little volume in that area. And although we can put Sculptra in there, one of the things that I really like is Renuva, which is cadaver fat. So that's fat off the shelf, right? And so we take that fat and we can inject it into the cheeks. And what I like about that, once the fat engrafts and it stimulates your own stem cells, produce your own fat, this is long term. Of course, your cheek's going to age like we all age. We never can stop the aging process, but it should be, those fat cells should be there in perpetuity. Okay, so what do we do with the fat? We have about a minute and a half here, I think, 2 minutes. And so what is the process of putting in Renuva in the cheeks for our patients and in the temple area?
Yeah, of course. There's always numbing to make it a little bit more comfortable for them. And then it comes in syringes as well, and it's all under a sterile. For us, we like to do it in a sterile procedure
Right.
environment.
Okay.
And there's, I think, a little bit more swelling than if we were to just do straight filler, because you're adding the local anesthetic to the
Right.
area.
Okay, so what Karina is mentioning is that I like to make my patients comfortable and kind of an empath. So we do take a little bit of direct local anesthesia. We inject it in the area where we're going to inject the Renuva. It just makes it more comfortable for the patient, allows me to layer it in a really precise fashion. So we do that. So you are a little swollen. In fact, we did that on one of our patients today, and I just got a text message from her saying, you know, my eyebrow is a little bit lower. Is that from the local? And absolutely, it's from the local anesthesia, and that's going to resolve in the matter of hours to a day or so. But that will absolutely resolve, and that's due to the local anesthesia. So we have these great treatments. They're actually called biostimulatories, Karina, and that's where we stimulate our own biology. So what are the three that we just got done talking about?
Easy Gel.
Easy PRF Gel for under the eyes.
PRF Gel, Renuva.
Renuva
and
for the cheeks.
Sculptra.
And Sculptra for that suctioning area. All right. So I want to thank everybody. We have about a minute left. We appreciate your support, listening in to us every Thursday from 12:30 to 1. And thank you again for just being here on Ask the Expert.
Absolutely. Always learning something new from you, Dr. Tom. So it's always fun to hear these great tips and different procedures, especially if you are in that Gen X like me or early Gen X. These are the kinds of procedures that you can have a consultation, talk with Dr. Tom and his team, and figure out really what works best for you. Reach out to Dr. Walter Tom of Dr. Tom Cosmetic Surgery with offices in Santa Rosa, Napa, and Maui. You can find him online and see before and after pics at drtomcosmetic.com or call 707-542-8346 for a consultation.